Hi, welcome to another Tuesday with Timeless. I'm Dr. Stefanie Christian. We have a lot of patients in our practice that have rosacea, and so this is a pretty common thing that we see. And 16 million Americans have rosacea. It's not a disease that can be cured. It's a chronic condition that can be managed, pretty easily managed, but it takes some education. And so hopefully that's what I will accomplish today. This is a chronic condition that affects the skin of the face, usually the central face, and it's characterized by flares and remissions. Although we see it in all skin types, the people who are most susceptible are fair-skinned individuals who are prone to blushing and flushing. There are 4 subtypes. The first one is vascular, and these people are those that started out blushing easily, but they had a little bit of burning and tingling that was associated with that. And then over time, they developed a stable redness that stayed in the center part of their face. And then that developed into visible vessels that became permanent, usually in the nose, and then the cheeks, and then eventually the chin, and even maybe the forehead. These are called telangiectasias. Subtype 2 is pustular. And for all the world, this looks like adult acne, but it doesn't have blackheads or whiteheads, and it has that same sort of burning, tingling sensation. Subtype 3 is thickened skin or rhinophyma. It's more common in men, and it occurs on the nose. And the skin on the nose becomes thickened and bumpy due to the excess skin. And subtype 4 is ocular rosacea. And we've learned a lot more about ocular rosacea in the recent couple of years. We used to think it happened in about 20% of people with rosacea. Now we know it's about 50% of people with rosacea. It can feel like dry eye, or it can feel like you have something caught in your eye. The eyelids can get swollen and red. The eyes themselves can feel dry and irritated, watery, bloodshot. They can get scaly. They can get chronically irritated and red. So those are our 4 subtypes. There are some secondary skin characteristics that can go along with rosacea. It's not uncommon to have inflammation of the skin that causes the skin to swell, and so it pulls the pores open. All you have to do is treat the inflammation and the pores get smaller, so it's not the primary symptom. Skin often becomes itchy and tight. People can get red raised patches. And interestingly, sometimes people have sort of rough, scaly skin, even though their skin is oily. Usually when you think of people who have rough, scaly skin, it's because the skin is dry. But in the case of rosacea, often you see this rough, scaly skin with oily skin. So what causes rosacea? Well, this is a mixed bag. There's definitely a genetic component. We used to think of rosacea as being something that happened only in people from the British Isles or from Germany or from a couple pockets in what's now Poland and Hungary. But there are definitely groups of people from Scandinavia that get rosacea, and people from Palestine that have rosacea, and other areas of the world. So it's more global than we used to think it was, and it certainly does cover all skin types. So there's a genetic component. It's definitely an inflammatory condition, and there are inflammatory mediators involved that we are understanding much better in the lab. Frequently goes hand in hand with autoimmune conditions, and there's an interesting mite. A lot of people can have the Demodex mite on their skin, but people with rosacea have an overgrowth of the Demodex mite, and they can be super sensitive to it to the point of being allergic to it. Those people can often be desensitized to the Demodex mite by getting allergy shots, and then their symptoms, perhaps they get the pustular type of rosacea, will significantly cool down. So those are the biologic parts of the rosacea. Then there's the environmental part. Everyone who has rosacea has triggers. 80% of people who have rosacea are sensitive to the sun. 80% of people who have rosacea react to stress. And then there's a list of about 18 others. And I refer you to a wonderful website, rosacea.org. But I'll go through some of the most common ones. Anything that increases your temperature, whether that be a hot tub or a sauna or a hot bath or a shower or really hot weather outside or exercise or a hot beverage, those can cause some people to flare. That doesn't mean don't exercise. It means exercise in the cool of the day. Make sure you're wearing wicking clothing. Make sure you're really hydrated beforehand and have a spray bottle so you can quickly spray your face if you're feeling that you're flushing. On the other hand, cold can do it. So really cold weather or windy weather can cause a flare of your rosacea. Alcohol can do it. It may not be all alcohol. For some people, whiskey might do it, or beer might do it, or red wine might do it. And it might not be all red wine. It might be certain varietals or from certain regions. We're not exactly sure what does it, but it has something to do with the vasodilation. So the enlargement of the blood vessels and the inflammation that causes. For some people, spicy foods do it. For some people, medications do it. Anything that has calcium channel blockers or nitrates or B vitamins in them seem to trigger rosacea for some people. Certain skincare products, anything that has alcohol in it, or peppermint, or menthol, or eucalyptus, or citrus, or olive oil in it. For some people, that triggers their rosacea. Dairy products. Dairy products are very inflammatory, and for a lot of people, dairy products trigger rosacea, and when they stop dairy products, their rosacea gets much, much better. For some people, acidic foods do it. So acidic fruits, acidic vegetables, marinated meats, those things will all trigger their rosacea. So how do we treat this? Well, as I always say, your skin is your biggest organ and you are what you eat. So given that we know that there's an inflammatory component to this, eating an anti-inflammatory diet really helps. The second thing is, because this isn't a disease that can be cured, this is a chronic condition that can be managed, it's important to know what your particular triggers are. Yes, there's a list of 20 triggers that are known, but you may only have 4 or 5 of them. So identifying what your particular triggers are and then figuring out how you're going to mitigate your exposure to those triggers is really important. Because yeah, I do have a laser that treats the vessels of rosacea, but that doesn't treat the underlying inflammation. And the best thing to do is to see if you can get around your exposure to those things. Wear a zinc-based sunscreen every day and not keep getting those vessels, so we don't have to be treating them every year or every 18 months. So I'm going to go through these treatments. First the medical treatments, and then the skincare. So for the redness, azelaic acid. Azelaic acid comes in a cream and it's anti-inflammatory, so it's really good for redness. Laser Genesis is a non-invasive laser. You leave with your skin glowing and a little bit pink, and it's really good for redness. Our esthetician does a mandelic peel, which is also very good for sensitive skin and really good for rosacea. It goes after that redness. For pustules, azelaic acid again, because it's targeting the inflammation. Ivermectin is a prescription medication. It's anti-inflammatory, but it also goes after the Demodex mite. So if you're someone who has the Demodex mite, ivermectin is a good solution. A lot of people who have rosacea have had experience with Metrogel. Metrogel is not great for the vascular kind of rosacea, but it is good for the pustular kind of rosacea, and that's because it's anti-inflammatory. It's not good for everyone with the pustular kind of rosacea, but more often than not, it is beneficial for the pustular kind of rosacea. For the vascular, once you have the vessels, lasers. That's the way to go. We have one of the best lasers for rosacea that there is on the market, but we become a therapeutic partnership. And so knowledge is power. The more you know about the condition that you're dealing with, the more you know that you have ownership of part of the process. For rhinophyma, for that swelling of the nose, azelaic acid again helps, because a lot of that swelling is edema, and if you can get the inflammation to go down, you can get the edema to go down. Retin A actually helps. It is an anti-inflammatory, and it also helps with decreasing that swelling. Oral antibiotics help for some reason. We're not exactly sure why they help. To date, we don't know of a bacterium that's involved in the rhinophyma. So we think it's actually an anti-inflammatory effect of the oral antibiotics. And then once the nose gets really big, then it requires surgical intervention to debulk that extra skin. And that can either be done by a plastic surgeon with a laser, or by a plastic surgeon in the operating room using a scalpel. They do a lovely job. In terms of the ocular rosacea, there are prescription drops that work very well as anti-inflammatories for the ocular rosacea. So now, in terms of products, gentle cleansing. And I can't emphasize enough the gentle cleansing. Scrubbing is for floors. You never scrub your face. This whole idea that you would ever use apricot scrub, chopped up apricot pits, has always sort of astonished me. When you're cleansing your face and you have rosacea, you want to use a very, very gentle cleanser. Aven anti-rougeur line is wonderful. Because we have such a large rosacea population in our practice, we've had a lot of experience with people using this line, and they just love this line. It's got Aven thermal spring water, and this water takes about 50 years to go through the stone in a mountain, and it picks up zinc and selenium, which are anti-inflammatory minerals, and it's been used for skin issues for 400 years, and very, very effective. Zinc sunscreen every single day. Every single day, and it's got to be zinc. Can't be chemical. It's got to be zinc, because then you're going to be protecting yourself against both the UVA rays and the UVB rays. And why do you need it every day? Because the UVA rays, the ones that are going to be particularly bad for blood vessels, penetrate ozone clouds and glass. So if you are near a window at home, or near a window at work, or in your car with a window right there, you're going to be getting those UVA rays, and they're going to be aggravating your rosacea. So zinc sunscreen every single day, even on cloudy days, even in the winter. Retinol. Retinol is a gentle retinoid. If retin A is tretinoin, and it's right here, it's the strongest, you want to back off a little bit to retinaldehyde. And it has anti-inflammatory properties. And so it's very good for treating the redness. It's also very good for treating pustules. Because remember, the pustules in rosacea are not, they're not infected unless there's a super infection. It's inflammation. And so retinol is good for preventing the pustules, it's good for treating redness, and it's good for treating the pustules. And then Aven has a calming, soothing repair mask, which is really good for a flare. And it's also just really good for soothing if your skin is irritated by something, or if you just want to do something nice for your skin and you're afraid of doing something that might cause a flare, that mask is particularly nice. So we do have things to treat the vascular rosacea. We do have things to treat the pustular rosacea. And we do have things to help you with your daily maintenance regimen. Rosacea can be frustrating. It can be hard to get a handle on, and it's because knowledge is power, and it takes time to teach someone. But we are good at doing that teaching because we believe that knowledge is power. If you'd like to learn more, you can make an appointment with Kylie, our esthetician, who is excellent at helping people choose products. And we are very, very glad to make a consultation appointment and talk about specific treatments to help you with your specific, whatever point you're at, if you're subtype 1 or you're subtype 2. So I hope this helps, and I hope this furthers your knowledge. Have a wonderful week.